The operating room black box is a platform that we developed here at St. Michael's and is being used in our operating rooms to improve patient safety, to improve efficiency, to improve organizational culture around safety in our operating theaters. But we felt that we can do better than that. We can provide value not only to surgeons, nurses, and anesthesiologists, but also to other healthcare professionals throughout our organization. So we use the operating room black box. We started using the operating room black box to evaluate risks, to assess risks to healthcare providers when caring for patients infected with COVID. And we used simulation to understand risks and to discuss how we can mitigate these risks and improve safety, not only for patients but also to our staff. So we found when we ran a set of simulations here at St. Michael's in collaboration with the Simulation Center and an initiative that was led by one of our anesthesiologists here at St. Michael's. And during these simulations, we found that there were significant risks. We found that in 70% of the cases, there was a breach of sterility that would expose the surgeon, the nurse, or the anesthesiologist to the virus. We studied and understood precisely where these breaches happen and how we can mitigate them. So we use this data to design better simulations, to design better education, and we found some remarkable results. We found that with this data that the operating room black box generated, we were able to demonstrate more than 80% improvement when taking on and taking off personal protective equipment. We found that we could reduce the infection breaches and the risks of infecting staff with more than 50%. We found also dramatic improvements in reducing risk during intubation and extubation, which will protect not only our anesthesia colleagues, but also nurses and the patients in the room. So overall, we demonstrated very clearly that data-driven education, data-driven simulation can not only improve our practices and improve our education, but it can result in very meaningful improvements or very meaningful reduction of risk to our staff and our patients.